Hey everybody, and welcome to today's video where we are going to talk about ionizing radiation. In particular, is it harmful, like you see in the movies where a bomb goes off, we get blasted with radiation and everyone dies? Or is it helpful, where if you're like me and you fall off a skateboard and break your arm, you can go to the doc, she gets a nice x-ray of it, gets you all fixed up, and you're on your way. So, radiation, is it harmful? Is it helpful? Maybe it's both. I don't know, but we're going to find out. And for those of you who don't know me, my name is MediPhysMan. I am a medical physicist who has spent my whole career studying how radiation interacts with the body for the purpose of improving how we image, diagnose, and treat disease. So with that, let's get started. All right, here we go. So a quick disclaimer before we get started. This video is for informational, educational purposes only. If you ever find yourself in a position where you need to get a medical image or you're concerned about radiation, you need to talk to a doctor. Consult with your qualified medical professional. And as always, all the information I used to make this video, all the facts and figures, I've left links in the description down below. So go check it out after you've watched this video. All right? So radiation, what is it? That's an important thing to know if that's what we're going to talk about, right? Now I'm talking about photons or light waves in particular, and these run from the very low energy side of the spectrum like radio waves and microwaves, all the way up to the high energy stuff like X-rays and gamma rays. There is also particle radiation, and these are just basically pieces of atoms that have broken off and are flying around like electrons or protons or even an alpha particle that's been kicked out of a nucleus. And in particular, for these types of radiation, we put them in two categories. There's non-ionizing, and so this is the lower end where they can excite an atom or a molecule, but they can't really do a lot of damage to it. And then there's ionizing radiation, which does have enough energy to actually damage and break apart molecules and atoms in your body. And when we're talking about the effects of radiation on the body, today especially, we're talking about this ionizing radiation. Next, let's talk about radiation dose. If someone says to you, you received X dose of radiation, what does that mean? What we mean by dose is when the radiation passes through your body, it is going to transfer energy and it's going to be absorbed by your body. So basically, dose just means the amount of energy your body has absorbed from the radiation. And that's typically given to us in units of gray. 1 gray of dose is the standard unit of dose. Or you may hear people give you a unit of sieverts. They're about the same for our purposes in this video. So 1 gray equals 1 joule of energy absorbed per kilogram in your body. So 1 joule of energy absorbed for 1 kilogram of tissue in your body. So let's kind of put that in perspective, right? Is 1 joule of energy a lot per kilogram? I don't know. Well, let's think of it this way. If you're like me and you weigh about 80 kilograms, at least before, the holidays, 1 gray of dose to your whole body. So let's say your whole body absorbs 1 gray of dose. That would mean your body absorbed 80 joules of energy. So 80 joules per 80 kilograms, 1 gray of dose to your whole body. And to put that in perspective, is that a lot, 80 joules? Think of it this way. A light bulb, an 80-watt light bulb, is going to emit 80 joules of energy every second. Right? So in 1 second, it emits the amount of energy it takes for your body to absorb 1 gray of dose. So wait a minute. Should I be worried about light bulbs? Are they dangerous? No, light bulbs are not dangerous at all. Think of it this way. Remember, light bulbs are emitting visual light. So this is non-ionizing radiation. Remember, it's in that non-ionizing part of the spectrum we looked at. And so most of the energy is just going to reflect off of your body. However, a little bit will get absorbed by your body, and it's mostly going to be absorbed on the surface, and it's going to heat you up. And what we mean by this absorption is basically as the light hits your body and interacts with the molecules and atoms, it basically makes them vibrate and excites them, and that's what you feel as heat, right? So it's not doing any damage to the internal tissues. It's maybe heating you up. Now, if you touch a light bulb, you put your hand on a light bulb, that could hurt you. So don't do that. So let's compare or contrast that with ionizing radiation. Well, remember, ionizing radiation can damage the internal tissues in your body. Why? As the ionizing radiation penetrates, it's going to go all the way through your body and it's going to transfer energy. Your body's going to absorb energy from that radiation. And so, as the radiation passes through, it's actually breaking the molecules, causing them to break. As the molecules absorb energy from the radiation, they break apart. And same possibly with atoms in your body. So this is the difference between ionizing and non-ionizing radiation and how they interact with your body. So let's talk about this damage to molecules from the ionizing radiation within our body. So we know that as radiation passes through our body, what's in our body? It's going to pass through the cells in our body. Those cells have a nucleus, and inside of the nucleus is our chromosomes, which are made of DNA, the very blueprint of who we are. So if the radiation passes through the nucleus and it encounters and ionizes the DNA, it can actually break the DNA inside of the cell. And it's these DNA breaks that cause the actual harm to our body. Now, why is that? Well, our cell needs to read the DNA to do its normal everyday functions, like create proteins and enzymes. And when it comes time for the cells to divide, it needs to be able to read the DNA to replicate it and make a new copy for the new cell when it divides. Now, if it can't do these things, it doesn't function efficiently, and eventually it just sort of withers away and dies. And if this happens to enough cells within an organ or tissue group inside of our body, this is what makes us sick. We will get sick from that. It's these DNA breaks that really make us sick. The thing to note is DNA breaks happen all the time in our cells, up to 5,000 times per day in a cell. And these happen from all kinds of just natural things that happen, maybe environmental toxins, or when your cell is trying to read your DNA, that process can actually cause it to break. Or when the cell's burning energy as part of its normal metabolism, that can break your DNA. And these are the same sort of breaks that radiation causes. So up to 5,000 times a day, your DNA is getting broken. So why are we even here? That sounds like a lot of breaks and a lot of disruption to your cell function. It is a lot. However, there's a big however coming. However, there's one important thing we need to know. Our body has this amazing ability to heal DNA breaks. So if the cell senses your DNA is broken, it kicks a whole function into gear, which can actually heal up these DNA, make it good as new, so that your cell can read it, perform its functions, it can divide as normal, and we go on about our lives. Woohoo, we're not sick at all. Why then are we worried about radiation and radiation damage? If our body can heal this DNA damage and go on about its way, its normal routine, why are we even worried about it? Well, there is such a thing as a dangerous dose. So if you get too much radiation, it does too much damage to your DNA, then your cell can't properly repair everything, and that causes the problem. So what is this dangerous dose? Well, if you ask 10 physicists like myself, you're probably going to get at least 12 different opinions of what that dangerous dose is. It's a very complicated topic. But let's look at it this way. If you get a rapid whole body dose, or your whole body receives a dose all of a sudden, we know that if that dose is less than 1 gray, you have a small chance of getting sick, mildly sick. As that dose goes up and up to 6, 8 gray, your chances of getting sick go way up. And there's a pretty much 100% chance you're going to get sick, and you're going to get very sick. So what I'm talking about here, acute radiation sickness, at low doses, you'll start to feel nausea and some vomiting. And as the dose goes up, those symptoms there get worse and worse. And as you go to higher doses, then you'll start to see things like anemia or loss of blood cells. So your body can't, quickly and routinely and efficiently heal wounds because it doesn't have enough blood cells. And you can't fight off infections. And as the dose continues to go up and up, you'll start to get dizziness, headaches, and some really, really bad symptoms at that point. What about other symptoms like death? That's a big symptom. Again, at low doses, you pretty much had no chance of dying from radiation below 1 gray. But as the dose goes up and up and up, you can see that probability is getting higher and higher, especially without medical attention. And so if you look at these two graphs, In my opinion, this is me personally, I kind of put the threshold for what is a dangerous dose at, 1 gray. So any dose, and I'm talking a whole body dose here, greater than 1 gray is going to be dangerous, and you should probably seek medical attention. And it's not just me that's saying that. I mean, if you read the United Nations, the IAEA reports from the committees that have studied this, they often say greater than 1 gray is a dangerous dose, and they sort of set that level for the need for medical attention. So what are the sources of radiation that we encounter every day in our life? The one thing to note is we are exposed to radiation all the time. I mean, it's just around us in our environment all the time. And probably at least half, if not more, of the radiation you're exposed to every day comes from natural sources like outer space or the buildings we're in or the ground around us, or even, the food we eat contains radioactive material. Now, the rest of the radiation that we're exposed to come from man-made sources, much like leftover nuclear waste from nuclear bomb testings in the 60s and 70s, or medical procedures like imaging procedures, or even the consumer products we buy, again, have small amounts of radioactive materials in. So what are some common radiation doses that we're exposed to? Well, let's look at it this way. So here, again, are some sources that we're exposed to all the time. Natural sources, man-made sources, right? And if we set our dangerous level to be 1 gray or higher, then let's look at the sources or the amount of radiation we get from these sources. So let's take the background sources. Here's some typical ones, and we're talking about an annual dose here. So this is how much radiation dose you get from these sources for the whole year. So we're talking 0.003 gray or less, so 0.3% of that dangerous dose or less from any source. So your background radiation is going to be way below that 1 gray dangerous level. In fact, if you took all of these sources and added them together, the annual, it would take 250 years worth of annual dose all at one time for you to even reach that level where things start to get dangerous. What about medical procedures? So think about like a CT scan or an X-ray you get. Again, this is like 1% of that dangerous 1 gray level or less. And if you looked at it, you would need, again, 100 CT scans all at one time to even reach that dangerous threshold, or something like 10,000 chest X-rays all at once, which is just, nobody's going to do that to you. So again, not something I'm super concerned about. Our medical procedures are way below anything that reaches a dangerous level to your body. I've been talking about radiation sickness, death. What about other symptoms? What about cancer? That's a big risk from radiation. Look at it this way. In the event of a radiation accident, and we're talking about a bomb or a big radiation accident going off, so a big whole body dose all at once, at low doses, and they've figured this out from studying survivors of the World War II atomic bombings and from Chernobyl accidents and stuff, and they found that people who received less than 1 gray of dose, there was really no definitive proof of increased cancer in those individuals. Now, higher doses, as you go above 1 gray, the risk of developing a cancer in their lifetime starts to go up. And they found that young people, if you were exposed to this dose at a young age as a child, they had an increased risk of things like leukemia and thyroid cancer. And adults had risks of solid cancers like breast or lung cancer. Now, what about radiation therapy? If we're getting radiation therapy to treat a cancer, can that radiation we get for that actually cause cancer? So now we're talking about a targeted high dose of radiation to a specific part of your body received over a few weeks, right? So we're targeting the radiation to the tumor, rest of the body gets a very low dose. And so again, studying survivors of radiation therapy, cancer survivors, they've found that the areas of the body that receive less than 1 gray, there's really no definitive proof for an increase in cancer caused by that radiation. Now, if we're talking about areas of the body that get a higher than 1 gray of dose because of the radiation treatment, now you start to see an increase in risk in developing a secondary cancer later on after you receive radiation therapy. And it depends on, your tumor, your overall health, your age. There's a lot of risk factors that go into this, but they found for the typical doses given for radiation therapy, there might be somewhere between an 8 to a 16% increase in the risk that you would develop a cancer in the high dose regions after radiation therapy. Now, what about medical imaging? So now we're talking about an intermittent, every once in a while, a low dose you would receive from getting a medical imaging procedure. So again, the evidence is really inconclusive here, and it's really hard to determine if any intermediate low dose can actually cause cancer later on in life. Now, there is some evidence, there's been some studies published about an increased prevalence in brain cancer for children who received CT scans, head and neck CT scans. What they found was there was about a 12% increase in risk per CT scan. And we're talking about a typical CT scan that might give 0.01 gray of dose. This does not mean that 12% of children who get CT scans of their brain will get brain cancer. Does not mean that at all. If we look at what's the risk of getting brain cancer, just normally if you don't get a CT scan, and that's about 3.1 people out of every 100,000 will just develop a brain cancer. That's your risk. Now, for the children who receive CT scans of the head and neck as a child, their risk was 3.5 per 100,000. So the risk went up slightly. 3.5, that's about 12% higher than 3.1. But if you think about it, the overall chance of getting a cancer is extremely, extremely small, 0.0035%. So I still got to think the benefit of getting that CT scan far outweighs any increase in risk that might occur because of it. If you go to the doc and the doc says, hey, we'd like to get an image of your broken arm after you fell off your skateboard. Remember, the image doses you're going to get from that are about 0.001 to 0.01 gray, so less than 1% of that dangerous dose level. Some studies I've read say there's about 40 DNA breaks in your cell from 1 gray of dose. So think of it this way. A CT scan, one imaging study would be about 0.4 DNA breaks, extra DNA breaks in your body. Now, remember, if we talked earlier that there's about 5,000 DNA breaks in your body just naturally every day, somewhere on that scale. So we had 5,000 normal breaks, plus let's say one from our imaging study, that's 5,001 DNA breaks every day in your cell. And remember how efficient our cells were at repairing DNA damage? They could do this easily. So I would say the one extra DNA break you get from that CT scan is really insignificant and is not really going to cause a problem. Okay, I've been talking a lot, so let's wrap this up. We want to know, is radiation helpful? Like, you think you're cool, you're like me, you go riding your skateboard, you fall off, you break your arm. You go to the doc says, hey, let's get an x-ray of that. X-ray helps them find the break, get it all set, get you all fixed up and on your way, right? Well, all right, doc, you had to know I was going to get back on my skateboard. Sorry about that. Or is radiation harmful? So let's say you're just, you're on a ride through the park, you encounter a radiation spill. Unlikely to happen, but let's say it does. What do you want to do? Yeah, you want to probably not hang out there. You want to get away from that. All right. I don't know why they didn't just run the other direction, but anyway. What you want to do is not hang out, absorb a lot of dose. Because remember, when we're talking helpful radiation, we know the benefits because it helps us diagnose and treat injury and disease. It's reduced or almost eliminated the need for exploratory procedures like exploratory surgery, right? So it is very, very helpful. But there are risks. We need to remember high doses can cause harm. It can make you sick, it can give you cancer, it can kill you. So there are harmful effects of radiation we need to be aware of. It's harmful at high doses and high dose rates, but when used medically at very low doses, it's very safe. The benefits from any radiation we get far outweigh any risk. So as always, if you need to get an image, if you're concerned about radiation, please go talk to your doctor. And so with that, I think that's about everything I wanted to say, guys. All right, if you have questions, comments, concerns, please leave it down below. I'll try to answer any questions I can. And if you have an idea for a video you'd like to see me do or a topic you'd like to see me cover, please leave that down below too. I'll see what I can do. All right, we'll talk to you next time, guys. Bye.